are you?
Good.
So I like to talk to you and ask you some question about the dry needling.
Oh, okay.
So dry needling has become so popular in this country, and I want to differentiate the dry needling and the traditional Chinese acupuncture, because you went to acupuncture school, right? For how many years?
Oh, 3 years.
3 years. And you learn all the theory based on, so the acupuncture based on the internal organ dysfunction,
There's a science to acupuncture. You learn the meridians that are in the body, which are the highways, and how to treat each individual organ. Dry needling is just sort of like attack the area and put as many needles in as you can. And I just don't think it's as effective as a thinking pattern like acupuncture.
Yes, and the other thing, if using modern medical point of view, I have patients that had a dry needling. They said, oh, I have shoulder pain. So they're gonna put like 20, 30 needles there.
It's like very Western-like. Let's attack the area with as many needles as possible. No, you want to stimulate the area. Maybe work on the opposite side. And there's a methodology to it that works and has worked for millions of years in China.
Yes, and then I asked them, if you have a lot of needles here, you dilate the blood vessel and you rush all the blood flow here.
Exactly, you can give too much blood and too much stimulation to the area. Maybe the area's not ready to handle all that extra blood flow.
Yes, and also our theory also will see, if you have pain here, but also if your kidney is weak, your digestive system is weak, then we need to add other points to improve the function of gut, right?
There's a science to it. There's methodology. It's been working for millions of years. It works.
So anything has to be balanced. You cannot just put needles in one area and ignore other. You may be able to relieve the pain temporarily, but if you still have unhealthy gut, unhealthy adrenal gland, what happens?
You get sick anyway.
Yes. So the pain is relieved temporarily, and then your bone and your muscle are still weak, then you're gonna have pain again.
In a Western perspective, it's the right idea, but there's no methodology. There's got to be some thought process. You just can't attack the area with as many needles as possible. It's barbaric.
Yes, and the training is a little different. I mean, you were trained so many years, and you learn the theory, you learn the herbs, you learn the channel, how the channel connected with the organs, right?
Yes.
So we cannot just target one small area. That will be short-term relief, and also, you don't enhance the other functions.
You want the body to pick up the points, not be overwhelmed by the points.
Exactly. So balancing is the key. Even like yin and yang is a traditional Chinese medicine, but let's talk about Western medicine. They started talking about balancing, like balancing hormones and also immune system. You have a stimulating part, you have a relaxing part. If your immune system is out of whack and also all the stimulating part is too strong, what happens? Allergy?
Too much stimulant makes the body go wild, antihistamines, everything.
Exactly. And then hormones. You have too much stimulating hormone, too little.
It's all about balance. You don't want to unbalance your body. Stay balanced.
Yeah. So if you want to go dry needling for a short period of time to experience what kind of effect is that, I guaranteed the effect is short term. You get a little bit of relief, but you haven't addressed your other problems.
Exactly. Nothing's been addressed. Nothing's been cured. Nothing's been gotten to the bottom line. You're just sticking a bunch of needles in one spot and hoping for the best.
Yeah, and also the whole body. The reason you got this muscle weakness or ligaments teared, overuse is one thing. Inflammation is the second thing. The third thing is you may have a weakness, right?
Oh, yeah.
Yeah. So if after menopause or men after 50, 60 years old, their hormone is lowered, so the muscle is weaker.
You lose your strength as you age.
Yes. And on the other hand, if the pain is temporarily reduced, just like you have a cortisone shot, okay? And then you said, oh, I have no pain, so I can do whatever I want.
It's a false sense of security.
Yeah, and I have a case study, a lady who had a shoulder pain, and she got a cortisone shot, so she has no pain. And so she painted the whole house one night. Guess what? He torn all the ligaments around the shoulder joint.
It's a bad Band-Aid.
Yeah. So the pain is a signal. You want the signal gradually reduced while you balance the muscle, reduce
You
the
know what I
injury.
say? The body's always talking to you, but are you listening?
Yes, yes. You gotta. You never take. You take very little painkiller, right?
I don't believe it. I just think it fixes the problem at the moment, but then it gives you long-term problems in the end.
Yeah. So little bit of pain signal, and then you gotta solve that problem, and then you can sense that the pain signal gradually goes down.
Why
and you know
do we punish our body for telling us the truth?
exactly. That's right.
I mean, why do we punish our body for communicating to us? Why do we tell our body to shut up? Why don't we say, I'm listening, tell me more, what can I do?
That's right. Yeah, we need a pain signal.
Absolutely.
Yes. So you make judgment, and if you want to go to an acupuncturist and herbalist, or you want to just get dry needling